Good morning, everyone, and welcome to today's live update. I'm Provost John Zomchik, and as you've already probably guessed, I'm filling in today for Chancellor Plowman, who couldn't be with us. I'm here with Dr. Spencer Gregg, our usual guest, who's joining us today from a vaccination clinic at our student union. As you also might expect, today we're going to talk through some of the guidance we've received on the Johnson & Johnson vaccine and some of the actions we've taken in response to that. Then we'll go over our recent case counts and other data. So let's get started. On Tuesday, we canceled our public vaccination clinics after the federal government recommended states pause distribution of the Johnson & Johnson vaccine. This was one of the vaccines that we were using on our campus. So I'm going to turn to Dr. Gregg now. Dr. Gregg, what is the issue with the Johnson & Johnson vaccine, and why did the federal government issue that guidance?
Well, good morning, Dr. Zomchik, and happy Big Orange Friday. Yes, it has been an interesting week to say the least. We received news this past Tuesday morning that out of an abundance of caution, the CDC and the FDA were recommending a pause in the use of the J&J vaccine, the Johnson & Johnson's Janssen COVID-19 vaccine, because of the safety systems that make sure vaccines are safe, had received a small number of reports of a rare but severe type of blood clot happening in people who had received this vaccine. Now, to put this in context, by last report, we're talking around 7 reported cases in approximately 7.3 million doses of the J&J vaccine that have been given. But still, the CDC and FDA just want to be safe. So that's why its use has been temporarily paused in the U.S. until additional information can be obtained and disseminated. So, in accordance with those directives, we too have paused the use of the J&J vaccine on campus and are currently only administering the Moderna vaccine. No cases of this type of blood clot have been reported among the more than 180 million people who've received the Pfizer and Moderna vaccines.
Thank you, Dr. Gregg. So what will be our plans going forward with respect to administering vaccines here on campus?
Well, we had found out about the J&J pause on Tuesday morning, just before the start of our planned clinic at the student union. And we immediately acted to cancel not only that clinic, but all our clinics where use of the J&J vaccine had been planned. And we worked with the patients who'd already showed up to reschedule for a Moderna vaccine. We also started contacting individuals who had been scheduled to receive the J&J vaccine for later that day at the clinic and at any of our other planned J&J clinics to make them aware of the pause and to give them the opportunity to reschedule to receive the Moderna vaccine. And finally, we began to publicize the new availability of the new Moderna vaccine clinics through our websites. It was a lot of work to get accomplished in a short order, but by everyone stepping up and helping out, we had that accomplished within about 2 to 3 hours of finding out about the pause. And we are currently holding our supply of the J&J vaccine in anticipation that its use may once again be approved, albeit with maybe new updates to possible precautions or contraindications to its use. And in the interim, we'll continue to offer the Moderna vaccine through clinics at the Student Health Center, and if indicated, based on demand, through some mass vaccine clinics again at the student union.
Do we have any clinics scheduled for next week? Any of those student union clinics?
We do not have any scheduled at the student union for next week. All the clinics for next week, again, are Moderna clinics, and they are at the Student Health Center.
Thanks, Dr. Gregg. So another question for you. After a student or anyone gets their first dose of the Moderna vaccine while they're here on campus, how should they get their second dose, especially if they are leaving campus and going back home after our semester ends?
Well, as folks are exiting our clinics, we're still going to be offering to schedule them for their second dose of Moderna here on campus. But for those who aren't going to be on campus 28 days later, we're advising them to make contact as soon as possible with other local vaccine resources where they will be located to arrange for their second dose. As you know, in order to be fully vaccinated with the Moderna vaccine, it's imperative to receive both the first dose and then 28 days later, the second dose. Moderna is now widely available through vaccine resources in other communities across the nation, at vaccine events, retail pharmacies, public health departments. So we feel confident that it will be available elsewhere to those who will not be here on campus in 28 days. But it's going to be important to get signed up for that second dose as soon as possible. You don't want to put off scheduling to the last minute. Find out what's going to be available, where you're planning to be, and get signed up for it. And again, if you're going to be on campus, then we'll be scheduling you here as you're leaving your first dose clinic.
So if I understand correctly, Dr. Gregg, there's no reason why a student couldn't come and get the first dose here, because you expect that the second dose will be widely available if they do leave campus.
Yes.
Good, thank you. So one more time, for anyone who's already received the Johnson & Johnson vaccine, what do they need to know?
So to put this issue in context, again, by last report, we're talking around 7 reported cases of this rare but serious type of blood clot in approximately 7.3 million doses of the J&J vaccine that have been administered. But still, we just want to be safe. There are signs and symptoms associated with this type of condition, and it's important for people who've received the J&J vaccine, especially those who've received the vaccine, the J&J vaccine, within the past 3 weeks. Should they develop symptoms of a severe headache, backache, new neurological problems, severe abdominal pain, shortness of breath, leg swelling, tiny red spots on the skin, we call those petechiae, new or easy bruising, they should seek medical care right away to be safe. If you've received the vaccine more than 3 weeks ago, the risk of developing a blood clot or receiving or having these issues is very low at this point.
Thanks, Dr. Rick. That is very, very helpful information to have. So just to repeat, the vaccines are safe, and we want as many people as possible to get their vaccine as soon as possible. You can schedule an appointment on campus or find an appointment closer to where you live by going to www.utk.edu/coronavirus/vaccine. Or you can go to our coronavirus page and click the vaccine tab at the top. Well, now we're going to turn to our COVID case count and trends. You see there the graph on the screen. As of this morning, we have 38 active positive COVID-19 cases. 37 are students, and 1 is an employee. We're very glad to see the trend lines continuing downward. We now have 119 people in quarantine or self-isolation. This includes 42 students who live on campus, 62 students who live off campus, and 15 employees. And again, the trend line there is positive. Let's turn now to our testing data. Last week, we tested more than 2,022 saliva samples from students in pools of 3 to 4 samples. Based on those results, we sent 33 individuals to receive diagnostic testing. Of those who were tested, we identified 6 positive individuals, 6 out of those 33. The overall participation rate for residential students dropped again this week to 34%. Our positivity rate across all samples was 0.3 of 1%. Next week will be our last week for saliva testing on campus. If you live on campus, please remember, testing is required unless you are fully vaccinated. Now let's turn to our metric summary. As a reminder, this table includes indicators that we use to evaluate whether to tighten or to ease the temporary restrictions that we have in place. I'm going to turn to Dr. Gregg again. Dr. Gregg, how are things trending in our broader community?
Well, as you can see on campus, both our active cases and new cases are continuing to generally trend downward, as are our overall self-isolation. So we're definitely headed in the right direction. But we still need optimal participation in our saliva testing for our on-campus positivity rate to remain meaningful. So please, students, there's only one more week to go. Continue with your participation in our saliva testing. Let's get those numbers up during that last week. In the greater Knoxville community, we're seeing some drop in regard to their numbers. Their new COVID cases per 100,000 are continuing to decrease. Knox County now stands at 9 cases per 100,000. But hospital and intensive care use have increased somewhat over the past week. Additionally, some recent reports to us indicate that a younger population of patients is now being seen through local hospitals, and that's certainly concerning. We all have got to continue wearing our masks, continue to socially distance, avoid gathering in groups where folks are eating and drinking and where those guidelines aren't being adhered to. These remain our greatest risk situations and still need to be avoided. And finally, to further reduce the risk of infection to both yourself and others, it's imperative for everyone who can to get vaccinated.
Thanks, Dr. Gregg. That is, as always, very helpful information. So let me just reiterate what Dr. Gregg said. Want students who are living on campus, please, please, please participate in our saliva testing, because we need to make sure that we have meaningful results in order to understand what the trends are here on campus. 2, continue to follow all of the health protocols that we've followed all semester. That's important too. We are nearing the end of the semester. I'll say a little bit more about that in a moment. So please, please don't let down your guard. And finally, and most importantly, get vaccinated. Get that first dose of Moderna, because as you heard Dr. Gregg say, even if you're not going to be here 4 weeks from now, you'll be able to schedule your second vaccination wherever you are, as long as you don't wait too long to go through that scheduling process. So that brings us to the end of this live update. It's hard to believe, but our spring semester is coming rapidly to a close. Our classes here on campus end on April 28th, followed by 5 days of final exams, and then commencement ceremonies to be held in Neyland Stadium on May 7th, 8th, and 9th. So what this means is that next week will be our final live update. And I'm happy to report that Chancellor Plowman will be back to host that final live update next Friday. So before I close, I want to say good luck to all our students and faculty as we near the end of the semester. Finish strong. We know you can do it. It's been a tough semester, but we have so much to look forward to. Get that vaccine. We'll see you next week. I hope everyone has a great weekend, enjoys this beautiful weather. Go Vols.